Hello everybody, this is April the Priest and I'm here to talk about loosening up, release muscle tension for real stress relief. So we're going to talk a little bit about connecting the dots between stress and what happens within your body and your own muscles. This is an active seminar, so I want you to, I hope you have comfy clothes on and you can go through the stretches with me and you'll see really how effective some of this stuff can be. Before I get started, we'll talk about your credits towards your LMHF Wellness Program Part 2. You have to watch this whole thing in its entirety and do all the stretches. Comment on each video with your name. Once LMHF confirms it, your comments will be removed. So we'll talk a little bit before I show you all these stretches and sort of how to get at your trigger points. We'll talk about stress and muscle tension. So if you've watched some of their other seminars that we've done, when I talk about stress, we know that it's your body's response to something extraneous. So like 1,000 years ago, if you saw a saber-toothed tiger, you would have to run away from it. So your body releases all these stress hormones. Your heart rate increases, your breathing increases. So another thing that happens is your muscles tense up. So a lot of times it's right up in here for a lot of people. All this stuff to help you get up and go tenses up. So we're going to talk about that. So muscle tension is almost always a reflex reaction to stress. It's your body's way of keeping you from having an injury, having pain. Sometimes if you haven't, been trained in how to breathe, for whatever reason, we engage all these muscles up here and we start having shallow breathing. And it doesn't actually translate to better athletic performance, so I'm not sure why that happens, but stress brings it out of us. So the first thing you want to think about doing when you feel stressed is to pull that air, not up in here, but into your belly, and just try to relax your shoulders. But as we get through talking about stress and tension, I'm actually going to tell you what typically happens and then how to change that. So with the onset of sudden stress, muscles tense up all at once and then release their tension when stress passes. Chronic stress, so like if you're working at your desk for a long time and you see emails popping up, that kind of stress doesn't really dissipate. So this tension can just stay there. And then we might find things happening like some damaged muscle and trigger points and hyper-contracted muscle spots. So we're going to talk about that. So some of the symptoms that you might have from muscle tension are things like just general tightness, maybe spasms. You might have spasming muscles, tenderness, pain, burning. Sometimes that could happen if you've done enough. If you've got really tight traps, it can pull on your C2, your cervical vertebrae, second one, and that will then pinch the area where the disc comes out or where the nerve comes out, and you'll get a burning sensation all the way down your arms. Sometimes that can happen in your back as well, and it'll go down your leg. So these things can turn into something much bigger. You might have limited mobility. For instance, if you sit at a desk and you've got really tense shoulders, a lot of muscle tension there, you might not be able to, reach your arm behind your head or to, serve a tennis ball. So you lose some of your mobility. Another thing you might have is just sort of generalized fatigue. And this is something that I have come across lately. A lot of people complain about, and it's not something that we should just shrug off and say, oh, you just need to sleep better, oh, you just need to drink more water. This is something that's integrally tied with our hormones, our lifestyle. It's not like you can just go to bed earlier and everything will be better. So we'll talk about that as well. So some more muscle tension symptoms are things like tightness in your muscles, especially the shoulders, neck, back. Muscle tenderness, so if it's sore to the touch. Fatigue, we mentioned that. Tension headaches. Sometimes you'll feel something right here, like like a vice or a clamp right around your head into your eyeball here. And that is a surefire sign that we've got some trigger points and need some relaxation in our traps. Just general stress, so like being in pain and being tight can kind of double down on your stress. Anxiety, which also goes with stress, muscle spasms, muscle pain, and soreness. So we'll talk about, now just briefly, I'll touch on how hormones can affect your muscle tension. So especially during menopause for women, a change in your hormones, so like the lower estrogen levels, help to sort of increase cortisol and inflammation responses. So the more inflammation we have, so the more sort of damage there can be around muscle tissue and the tighter your muscle tissue can be. So it can actually exacerbate stuff that maybe you've already had going on. And we get a lot of complaints about this, like when we look at the Women's Health Initiative research and when we try to get women on exercise programs, a lot of times you'll hear like everything's just so tight and just so uncomfortable. And it's not women just being whiny. This is actually happening. You're actually tighter, everything's more inflamed, and you feel more in pain than you would have 20 years ago. And it's not just because you're old. It has something to do with, not because you're old at all. It's because of your hormones. I'm right there with you. So from there, we're going to talk about ways to reduce your muscle tension. So overall general ways are things like kind of figuring out what your stress triggers are and having a plan to mediate them right away. So like for me, I get really stressed when I just see like 100,000 emails in my inbox in the morning and I'm starting to work and then they just keep popping up like new emails. And I do this thing and I have this shallow breath and my shoulders creep up. So I'm trying to teach myself to just relax, maybe do a couple down dogs at my desk. Like I can't answer every email in the world. I can't answer, like I have like 200 students in one class. I can't answer all their emails. Like I needed like one of my grad students to do that. So you have to delegate, you have to have a plan, and you just have to, in that moment, remember to breathe, stretch, and just do what you can. So there's that. Then there's having a regular exercise program, which, believe it or not, does really help. It'll help you sleep better. It'll help because you're going to engage those muscles and help those tissues to reorganize. So that's really helpful. So remember, regular exercise is 150 minutes or more, the more the better, per week. It doesn't have to be anything hard. It could just be walking through the park with your friend. Also, resistance training is great. Resistance training could be with your body weight. Could just be like doing some squats and doing some planks. It could be using resistance bands. It could be with weights. You could take a Pilates class. You could do strength training at the gym. And I know that if you go to the YMCA, they have plans there for you and they'll show you how to use everything. So that's really nice to have. There are other things like mindful movement, which are turning out, like the research is showing how wonderful it is for everything. So things like fall prevention and stress management and bone density. And so mindful movement, that's stuff like yoga and qigong or tai chi, things that are really slow, that tie your breathing to your movement. So those are very helpful. And the next thing I'm going to talk about is myofascial release. And it's a really big, fancy, sort of sciencey term for just the fact that sometimes just stretching alone doesn't do the trick. It doesn't get rid of the tension. And remember when you talked about, like, if you're constantly like this, maybe you damage a little part, you may have some damage to one muscle cell. So all along your muscle fibers, I'll go from the beginning. Every muscle cell, let's say this is a muscle cell, contracts by having two sort of pieces of a zipper pull each other closer. So my thumbs are the ends of the cell membrane. And you have thousands of these lined up. And they just pull together like that. That's your muscle contracting. and then it pulls apart, and that's your muscle relaxing. So now you've got thousands of these lined up. Maybe sort of along this whole bundle of muscle fibers, we've also got something called fascia. And it's like kind of a papery, but it could turn liquid. It's really weird. And it helps to like keep everything intact. And sometimes that can get stuck or bound, or there just could be some damage in there. And then you get kind of what we might refer to as a knot, because like now there's something damaged. Your body's going to try to clamp it off, and your inflammatory response is going to happen. So like the same thing that recognizes a germ recognizes a damaged tissue, and it's going to go in and try to clear out the bad stuff and fix it. So while that's happening, this is all clamped down on, and you've got all these nice muscle cells and you're stretching those, but you've got this part here that's not going to undo itself. Okay, so that's kind of what a trigger point is. So you can get rid of those things by going to a massage therapist. During COVID, that might not be up your alley. You could go to like physical therapy, and they have all kinds of tools. They may cup you. They might like take these metal things that look like spoons and like scrape it out. There are people who dry needle. There's all kinds of ways. I'm gonna go through some ways I'll show you today for how to like just use, something for like maybe $15. You could buy a foam roller, or one of these sticks. This one's called the stick. I went to a massage therapist 20 years ago who was he was a triathlete, very competitive, and I was just beginning in triathlons. And he used a rolling pin. So you don't need to go spend anything. If you have a rolling pin, that could work. If you have tennis balls, or this is a lacrosse ball, that will work. You could just go to Marshall's sometimes and look at those little, where they have all the workout stuff. I got this there, and it's really neat. It's like a little plastic thing, and there's a rolly ball in it. So you could just, roll it on yourself or put it on the floor and lean into it and roll out some of those sore spots. So we're going to talk about that trigger point therapy and how you can do it on yourself. So myofascial release, that's kind of what I just talked about. It's an alternative medicine therapy. It's really just a way to sort of bust up that damaged tissue so that we can get everything stretched out and release that tension, okay? Let's see. It's an alternative medicine therapy claimed to be useful for treating skeletal muscle immobility, so it will give you mobility right away. So what I like to do, and what we found through research works the best, is if you roll and then stretch right away. So now you've kind of got broken up the trigger point, and then we can stretch out that muscle, and we should be clear sailing for a while. It doesn't mean that it never comes back. These are trigger points tend to be pretty similar in all kinds of people's bodies. So you can go, like if you go to a massage therapist, a lot of times they'll have a chart up on the wall of all the trigger points. And that's just because we're all built kind of similarly, and those trigger points tend to happen maybe where your weakest link is, that the damage happens in that part of that muscle. So a lot of times, I also do some training because I've done personal training to pay for college, I don't want to tell you, like 25 years ago. And I've sort of maintained some of those clients, so I still do some of that. And people will always say, because you know right away, because I've been doing this for so long, what's going on with their shoulders. So I'll tell them that that's happening. You probably have a sore spot right here, and they think I'm a genius. But really, it's just that everybody's body kind of behaves that way. So we're going to talk about how to get rid of those trigger points. A trigger point is just that sensitive area of the body. So like this is your trapezius. So in the slide, you're going to see a picture of a trapezius, and that's this part of your shoulder. It also runs down into the shoulder blade, but the top part of your trap is typically where you have the most tension. And right about here, usually it gets pretty tight. You usually got another spot right here, like where you feel the top of your shoulder blade maybe, and then creeping down into the shoulder blade. There's usually another one. And there are some others that can go up high and go up into the front of your neck. But, so that's a picture of your trap. And you can see a picture of like those long muscle fibers, like I mentioned, and you see those red kind of bulgy things. And that would be like where you have some damage and your body's trying to clamp off, and we're gonna actually break into it by just applying pressure so that it can relax And once that happens, we're able to stretch. Okay, so that's what a trigger point is. And I'll just go into why stretching alone sometimes doesn't work. So if you take like a rag mop and dunk it into a bucket of Elmer's glue and then just toss it into your closet, and then come back in like a week and you take it out and you're like, okay, I want to mop with this, but it's all a mess. Everything's tangled up and stuck together. And you tug on the ends. It's not going to hang straight and loose, all right? You're going to have lots of messed up things in there. So kind of breaking up the glue around that, you know, like working away at it and dusting off the glue, is kind of like what you're doing to get rid of those trigger points, okay? It's not going to work just to pull on them. It's not going to work just to stretch. We got to get rid of those adhesions where the glue is stuck on. Okay, so once we kind of break up all that stuff off, we can get all the strands to hang nice and loose. So same thing with your muscle. It's not exactly the same, but it's similar. You're going to be able to reorganize that tissue to stretch out pretty well. So ways to do that, again, you can go to massage therapy, you can go to physical therapy, and we can do it on ourselves. So we're going to try some of that. So we want to start off your workout sessions by foam rolling, and that way you're going to gain some mobility. You also could just, I don't know, on an off day when you come home from a walk, you might want to just go right ahead and foam roll and then stretch. Okay, so we start typically with our large muscle groups. You want to remember to take deep breaths into your belly, because when you get on some of those sore spots, it's gonna reactivate your stress response. All of a sudden you tense up, you have shallow breathing in it because it hurts. So you want to make sure you're taking deep breaths into your belly. When you come across a sore spot, and I'm going to do this with you, come across a sore spot, you're going to stay there. You find like something sore. We're going to stay there. You're going to take a deep breath in, let it out. And on that exhale, we're going to see if anything releases. And you just repeat that process. Inhale and hold, exhale and let go until you feel it sort of melt. You might shudder and it'll just kind of go away. Until you get no more releasing, or you feel like, oh, that let go, I'm done with that part. Then you can move on to the next part. So that's basically the trick with foam rolling. And if you don't want to go buy a foam roller, you could use anything else. But I'm going to go through that and show you what that is like. And after that, you go into some stretching. So stretching basics, things that you always want to think about doing are elongating your spine whenever you're doing any kind of like bent over, hold and stretch. So you don't want to look like this ever. You don't want to be leaning over yourself with a round back. It's kind of bad for your discs. You want to think about elongating your spine and bringing yourself down. Okay, so we'll talk about that. You want to think about asking your body how far it's willing to go today. You don't want to try to force it into a position that you think is the ultimate for the stretch. You just ask, how far can we go? And, you know, do the breathing. Take a deep breath in, relax, exhale, let go, and see what happens. All right, so we are going to start with just some calf rolling. So, and I'll show you too. I'll go to the rolly stick too to show you what you can do. So I like to start doing both. So you're just really going to sit up, use your arms. It's kind of a workout to go back and forth. And then, you know, usually we've got one side that's tighter than the other. And excuse me if I make weird noises or this is going to hurt. So you're going to never bring the roller up into this soft part of the back of your knee. You're just going to kind of go deep into the belly, like the meat of the back of your calf. And we're going to roll forward and back. And just so, like right about here, I have some sticky stuff. And you can see like my face changes, it hurts a little bit. I'm just going to stay right here. And notice how I apply pressure with the other leg. So it's not just hanging out in space. And you're going to take a deep breath into your belly. Exhale. And it kind of relaxes a little bit. And it's not totally gone, so I'll roll a little bit more until I find the sore spot, and I'll do it again. Take a deep breath in, and roll, let it out, and it relaxes. And you can do the inside, you can turn your calves around, and you would do one side and then the other side. But that's the basic, oh, this side's actually tighter. Ooh. So same thing, you find the sore spot, take a deep breath, exhale and let it go. And you just take your time, nice and slow, finding those spots. Oh, I got a lot of weird stuff in there today. So once you've done both sides, inside out, you address all of those spots, we could move on. Now I'm going to do an entire body roll and stretch today. So we're going to roll first, then stretch. So if you don't have a roller, you could always use something like this, and you just dig it in there. There's really nothing, there's no skill involved. You just find it, and then when you find that sore spot, you kind of hang out over it. If it's really sore, you might need to get a partner and have somebody help you. With your calves too, sometimes like having something like this isn't enough. So if you find that you've got a lot of sticky spots in there, you could always roll up your pants and then push your calf up. And you see this muscle here? You just dig your fingers into it and kind of creep along. And when you find those sore spots, just hold them and do the same thing. Breathe and let go. And then when you stretch, everything will kind of release. And it's remarkable the amount of mobility, the sort of angle that you can get in the calf when you stretch, or in the ankle when you stretch. So from there, we'll move on to hamstrings, so the back of your thigh. So I'll show you with this after, but you can just, same thing, knead into that. You could sit on a chair to get your high hamstring and use a ball. So you sit on the chair. So I'm not going to get into it very well on the floor because my butt's big and it touches the floor, but also my heel touches the floor. So, but you can kind of get in there a little bit. So if you don't have a roller, you could use the ball as well. With the roller, I like to start off again, so we're not going into the soft part of the back of the knee. You start just before there, and you just do both legs for a few rolls. And then cross one leg so we can push down into that hamstring. And just back and forth. Turn so we can get the inside of your thigh. That's where your adductors are. And your adductors bring your leg close to your body, your inner thigh. Usually we've got some nasty stuff in there. So you same thing, take a deep breath in when you find the sore spots. Exhale, let it go. And it just usually kind of surprisingly lets go. And then you can do the outside, so outside of your leg. So the outside of your leg, you're going to do one at a time. You're going to lie on the side. Top leg comes over, so we're making a figure four. And then you're just going to take one arm way out in front of you and just roll down this side. So that's going to get the side of your quad and your IT band. And you're just going to roll that out a little bit. Same thing, sore spots, take your time over them, breathe, and watch how they let go. Then we'll do our quads. So quads are the front of your thighs. You just want to lie on this thing, never going to your knees. It's just from your hip to your knee. Roll forward, roll back. I'm going to make sure I don't get off the screen here. So just forward and back. And if you've got one side that you think needs more attention than the other, you can just do one side. So you kind of grip the floor with your knee and go up and down. And if you're not the kind of person who wants to crawl around on the floor, maybe you've had knee replacements, maybe you don't like putting your knees into the floor, again, go get your rolling pin. It works wonders. And you just pretend you're making raviolis. You just roll over those quads. After quads, we're going to do our back. So for your back, you're either, if you're going to use something like this, you need a partner. But this kind of goes really fast. You can go right on Amazon, you can go to Target, everybody has these things now. You're gonna start just by leaning over it. And I really like to do this stretch. So I just go back and forth, and once I get to right about here, you feel a lot of pressure, but because I'm right in the middle of my shoulder blades, cross your arms over your chest, brace your abs so your rib cage doesn't flare, and then roll back, let your neck go. And just see if we can get any what we call extension, so like a proud chest, any movement in that upper back. We spend so much time sitting and working in this position that our spines sort of start to look like, we call it kyphotic, look like they're round up on top. And this little practice sort of helps that part of your spine to open up. So roll out the sore spots and then practice some posture. You might get some cracks. It's like free chiropractic. It's nice. So up and down, it feels really good on your lumbar region. And then we'll get into your shoulders by going side to side. So again, you could just get a massage or have a partner if you don't have the roller for this. You could use a ball on the floor. So I can show you how to get in there with that next. We're gonna lie, I have a short roller. They make ones that are like 3 or 4 feet long, so you could just lie right on it and be comfortable. This one's a little short, not super comfortable. It's not bad though. So, arms are gonna go straight up, and you have to really use your glutes. You're gonna roll to the side and just get under that shoulder blade. Then we go to the other side, get under that shoulder blade. Usually feels pretty good. And that's really all there is to foam rolling. I will show you with a ball really quick how to get in there too though. So typically what I like to do is find my sore spot before. So like maybe you want to work at your shoulders with your fingers. And I know I have a sore spot right here. So I'm going to put the ball there and just lie down on it. And then you kind of can move your shoulder around and go back and forth. You find that sore spot and it'll feel like holy moly. And you do that thing where you just relax, take a deep breath into your belly, exhale, and it usually feels like, it could feel like something shatters and breaks up and you get a little shudder, or it could just feel like something melts and it's a really nice feeling. And then you'll be sort of able to get those stretches to work a little bit better. So after that, I'll just show you how to go through your whole body, everything we just rolled, and get it stretched out. So remember, the first thing about stretching is that we want to keep a long spine. So I'm going to show you how to do a hamstring stretch, hamstring and calf. Before I do that, I'm going to grab my band really quick so I can show you how to do it if you can't reach your toes. Here it is. So we're going to do calves. To do our calves, one way to do it is to just get into sort of this down dog position and press your heel to the floor. So if you feel like something's hindering you, you still feel that sore spot, you could roll it out again. So here we go, roll, roll, roll. And then you go right into that stretch. And if you don't want to be upside down, you could just push into a wall and stretch the back of your calf like that. Deep breath in, slow exhale. So that's our calf. After that, we go to our hamstrings. So if you have a difficult time touching your toes, don't worry, you could always use a towel. You could use a strap like this. You could use a rope, a jump rope, anything you have. We're gonna work on stretching our hamstrings, so the back of your thighs. You always wanna get at those calves first, because if they don't let go, you're not gonna be able to get your hamstring to fully let go. Also, remember, we are elongating our spine while we do this. So I'm just going to take, because on my first one, I don't reach my toes. I might never reach my toes, we'll see. So I just let this leg fall out to the side, however you're comfortable so that you're balanced. So if you're comfortable bringing it into your inner thigh like that, go ahead and do that. We're going to sit up tall. Now keep your knee soft, so we're not locking that knee out. But we are thinking about strengthening and contracting this quad. So sit up tall. Pull your toe towards your face and then tilt. So I'm a little more comfortable like this. Tilt at your waist forward. And that's it. We're just going to take a deep breath here. And exhale, fall forward. And you just repeat that until you get as far forward as you're comfortable going. Remember, not rounding at the spine, keeping your chest out, elongating the spine. If you want to do the other side, go ahead and pause the video and go on to the other side. After that, we're going to go into our glutes. So, to get into, your sort of your butt muscles, we're going to sit with our legs out in front of us and then cross one leg over the other and just give it a hug. So you should feel sort of the side of your hip. Remember to sit up tall, keep your foot sort of trying to point away from you. Deep breath in, exhale, relax. See if you can get any more movement out of that glute. And remember, we're not wrenching it to you, so like maybe yours only comes to here. That's fine. You're just going to ask your leg how far it's comfortable going. We're not going to try to push it through so that you can get it up against your chest. And we do that, and you just breathe through it. Maybe you take 3 breaths, maybe 4 breaths, until you feel like you're not getting any more release, and then you let go, and we do the other side. So if you want to do the other side, go ahead and pause the video, stretch that side, and we'll get into the next muscle. So for quads, remember that's the one where you lie down on your belly and you roll out the front of your thigh. One of the best ways to stretch this is actually lying on your side. So if you don't like lying on the floor, you could go ahead and do this in your own bed. You could do it in the morning if you want. I'm just going to hook my strap around my foot, and I'm going to bring the bottom leg up. So you're lying on the ground, kind of like your Cleopatra here. And you're going to just pull the top knee back, gently helping with your arm. Now if you can go ahead and reach your ankle, do that. If your leg doesn't like to bend as much as mine does, don't worry about it. Just go as far as you can, just pulling that leg back, trying to keep this guy down on the ground, bracing your abs, and just allowing the front of your thigh to relax. And you do the same thing. Deep breaths in, exhale, and relax. So this is my favorite way to stretch the quad. Another way would be to be on one knee, or if you're standing, you could put your shin on a chair, but I'll show you on this leg. So you can come to this position and reach. So, is that good? Okay, so stretching the quads. So after the quads, what do? Back stretches. So to stretch this part of your back, you kind of want to make sure that you've got all of your, so we did our calves, we did our hamstrings, we did all the things that pull at our back. I told you that it's not a great idea to roll your back forward. That's not a great stretch for it, and that is true. But what we can do from this position is to go side to side. So we're going to get what we call our quadratus lumborum, which runs along the side of, like, so from here in your spine to the tops of your hips, the crest of your hips. It's like a triangle. And a lot of times they get tight and cause a lot of problems. So we're going to stretch that. If I want to stretch this side, this is my right side, I'm going to bend my right foot in, take my left foot out. If you don't like sitting on the floor, you could do this in a chair and your knees are just wide apart, okay? You're gonna take the opposite, so my left hand is gonna go on the inside of my right knee. So if I'm in a chair, I'm like this. And then keeping both sit bones into the floor, you reach up, deep breath in, exhale, go further. And you just repeat that until you feel like you're not getting any more stretch out of it. So sometimes it's 2 breaths, sometimes it's 5 breaths. Just relax and enjoy it. It should feel really good. If you want to do the other side, go ahead. We'll pause the video and reach. After that, we'll go into some neck stretches. So we've gone up the back, we got our legs. Now we're gonna get into kind of shoulders and neck. So these are some of my favorites. If you don't like sitting on the floor and you're in a chair, you can just sit up nice and tall and grab the bottom of the chair. If you're comfortable on the floor, we're gonna take our hands and interlock our fingers and just let our knees, so my ankles are crossed, just letting our knees sort of spill over our elbows like a bunch of flowers, okay? I'm sitting up tall. I have, pretend there's a puppeteer pulling my skull up towards the ceiling so my spine's very straight. Chuck your chin in so it looks like you have a lot of chins. And then you should feel a great big stretch happening down the sides of your neck. And a really good way, so I told you how to get at some of the trigger points in there, like behind your shoulders, with the ball. But it might be a nice idea if you have a partner to sort of go after these traps with the roller. And then go right into the stretch, because this is stretching those traps. So you just stay here and you do the same thing. Deep breath in, exhale to let go. And it should feel less and less tense the more we do that. So once you've got that sort of under wraps, you can let go of the bottom of the chair, you can let your flowers spill out of their base. And we can sit, so if you're in the chair, you just sit up tall. And if you're on the floor, just find a comfortable seat. So you could kneel if you want. I just like to sit crisscross applesauce. So we're gonna sit nice and tall again. Somebody's pulling their spine up towards the ceiling, and we're gonna get into all these nitty-gritty neck muscles. So I'm gonna take my right arm and aim it towards the floor. So it feels like somebody's pulling on my fingers, trying to pull this arm right out of its socket. Make sure your shoulder blades are tacked to your back. Pull your chin in. And then I'm going to take my left ear to my left shoulder. Feel a big stretch. Deep breath in. Exhale, let go. Then we're just going to look up at the ceiling and down, trying to keep everything in the same alignment. So up. You should feel a stretch in the front. You can help by kind of pointing your chin up if you want to, and then down. And you can help if you want to by just kind of walking your fingers along the back of your skull, applying a gentle pressure, just a little nudge. And then take a break, shake everything out, and you can repeat that as many times as you need to get until you feel like you're not getting any more release. And then we do the other side, same thing. So left arm, fingers towards the floor, pull that arm bone out of the socket, right ear to the right shoulder, sitting up tall, look up, look down, and you just repeat that. You can help get a little more mobility, and then walk your hands along your skull as you look down. Deep breaths in, exhale, relax, and you do that as many times as you need to. The last one, you can do the same thing. I would actually go back to this posture. So you're holding the bottom of your chair, or your flowers are back in the vase. Sit up tall, tuck that chin in, and then reach your jaw up towards the ceiling. Deep breath in, exhale, relax, come back down. And I would just repeat that 3 or 4 times, as many times as it takes to sort of get all that out of there. So we spend so much time having a lot of stress. This is usually the biggest culprit, of our headaches and our migraines and things like that. So these neck stretches are really helpful. There's one I didn't show you how to foam roll yet, and it's in your arm. And we spend a lot of time on the computer and on our phones doing these things, and so all of these muscles tend to get tighter than we know that they are. So I'll show you the last thing, how to kind of get into there and let that go. So if you're on the floor and you're comfortable here, you can do it this way. You're going to take the tips of your fingers, I'll go back. If you don't want to do it on the floor, you could always do this over a low table, like a coffee table. You could do it over your desk if you want to get your shoulders over your hands. But you're going to take your fingers so that the tips of your fingers are pointing towards your body, and roll your hands into the floor. And then you're going to rock your body back. And you just kind of go back and forth and feel deep in there. Feel that stretch. It's happening right in here. So you do that a few times, but then that kind of doesn't do the whole trick. So what we're going to do is let our palms come up and get into the first knuckle here, these knuckles. Just roll it back, let your elbows bend. You don't want to lock them out, and just lean back into there. And that's really going to get into those finger muscles. And that's usually really helpful. Sometimes too, this thumb, doing just those stretches doesn't get into the thumb. So you can pull them out to the side and back, and just kind of, when you're going through your emails or you're doing something that might be a little irritating or make you feel stressed out, you just pull back on those thumbs. Do some circles with your hands, shift your shoulders around, and we can do some of these stretches. So all of those neck ones you can do right in your chair. You don't have to be on the floor. They're super helpful. And I'll go through one more for your low back now that we did all the de-stressing ones, because I think this is like, in yoga anyway, the final de-stressor before you just lay there. So you're going to lie flat on your back with your arms out to your sides. You could do this in your bed. Feet are close together, knees touch each other, and you just collapse the knees to one side. Try to keep the opposite shoulder into the floor. If it doesn't bother your neck, go ahead and look over at that arm. And just inhale, exhale, let go. And do that 3 or 4 times. Take your time, switch sides, and really relax. You're asking your body how far it's willing to go. You're not forcing your body into any position. So that's really one way to sort of help to release those trigger points with the foam rolling with the ball, and then stretch to reorganize those tissues, to sort of tie your breath to your movement, which we know is de-stressing, but also, those trigger points got there because of your tension and your stress. So we kind of naturally tie all these things together. So hopefully your stretch and roll sessions are de-stressing and get you more release and mobility. Hopefully you like this. You can always go back and redo these stretches anytime. Feel free again to do the stretches or do the rolling, pause the video, and take as much time you need with each part of the stretch or part of the roll. And have a great day. See you later.